Started out on a one-way train, always knew where I was gonna go next. Didn't know until I saw you.
Welcome to Pull and Perseverance, and thank you for being here. My next industrious guest is Ms Loraine Molepo. Ms Molepo is ambitious, gracious, and a go-getter. Her journey to the United Nations Population Fund in Denmark is fascinating and reminds me of Paulo Coelho's famous quote, and I quote, "When you want something, all the universe conspires in helping you to achieve it." Unquote. Enjoy the episode. Hi, Lorraine. Welcome to Pull and Perseverance. I'm so excited to have you here. How are you doing?
Hi, Prof. I don't even know whether to call you Prof or yes, Prof. You've earned your stripes.
Thank you.
Hi, Prof. Fariachi. I'm doing well, thank you. And how are you?
I'm good. I'm fantastic. Thank you. Thank you so much for being here. So, there's been so much of excitement around what you're doing. So I want you to take us through your career as a pharmacist and how you got to where you are at the moment.
Okay. Well, yeah, first of all, I'm a pharmacist, thanks to vets.
Yay.
Many months ago. Yeah, so my career in pharmacy started, I guess I can say, in retail, I guess, because that's where I did my internship. In not necessarily retail, let me rather say hospital plus retail. I started with a Netcare hospital, so that's where we started, and then I went into community service, where it was it wasn't a primary healthcare facility, but rather secondary healthcare facility, where we actually serviced hospitals around the area that was in Carltonville, but also a lot of clinics. So that's where I did a lot of my hospital work. And that's actually where I also learned a lot of where I actually started with more of supply chain and more of getting into rural health. And yeah, after that, I came back and I joined Johannesburg General Hospital then, now Charlotte Macmaker Hospital. So I joined the hospital there, going back into, just the hospital pharmacy. So I think I started with how most of us really start, where it was either retail, then hospital. So that's really what I did. So my life with retail kind of like ended there, because as much as I loved it, as I appreciated it, I felt this is not really where I belong in the world of pharmacy. But I really enjoyed the hospital, my community service. I really enjoyed it because it was more all about just trying to be of service to those less fortunate or those who cannot access the healthcare in the metros. And then also having gone to an academic hospital, I think for me, what it spells was an opportunity to work in different spheres. So I worked in the oncology, I worked with pediatrics, I worked in the HIV clinic as well as the TB clinic, but also the main dispensary. So that's what I appreciated when I was in that space, to see that I can actually work in different spaces of pharmacy. And then while I was still there, something hit me. I think in life we always have this moment of a eureka moment or something that happens that hits you. So for me, I had a conversation with one gentleman who has been working there without really giving off my age. Literally, the man said that he's been working there since I was born, and he was still there. So the conversation was more on he knew better than I knew. So that really hit me hard. I was like, no, I'm not going to be this kind of a person to spend so many years in one position. So that really led me to say I need to do something with my career. And that's when I actually joined industry. Then my life with manufacturing phase started. That's when I actually joined Aspen. Funny enough, joining Aspen, it was a matter of, yes, I was an entry-level pharmacist, not having been exposed to production at all. And so one had to take a salary cut. And I was like, you know what? I'm okay with it. I don't have the responsibilities, but also I thought it's something new to, to branch into. It's new. I already know what's happening in a hospital pharmacy. I've already done the different clinics, so it will be good to experience something new. And looking back, I feel that has been the best decision I've ever made in my life. It was worth taking a knock of my salary. I think it was 2,000 Rand odd, somewhere there, instead of growing, from a financial point of view. But really, I enjoyed that. So I moved into production, and I really loved being in production. I loved, because being at a hospital setting, you are sort of like at the end of this medicine. So for me, I was like, I want to see how these medicines are made. So it was like, okay, I'm going to the beginning, the production, the packaging, making sure that they are reaching the end user, the quality aspect of it. So it was really more getting into the science aspect of, this is the medicine, and now that's where the medicine is going. I started to where the medicine is going. And from there, I think I started carving my career to say, look, if I can work like this, surely there are other aspects in pharmacy that I can explore. And that's really where it started with me, to say, let's see what other avenues are available in the world of pharmacy. And then I've done production, and then I moved to the Ministry of Health.
Okay, before you go on, Loraine, so I mean, I'm interested because I was looking at your career path, and I think you forgot to mention that you moved from Johannesburg to PE. Am I right?
Yes, that's correct.
So that was a big move. I mean, to move provinces and to have a salary cut, um, you know, can be challenging, especially when you're so early in your career and you think you need to be moving forward. So
True.
kudos to you for doing that. So I mean, getting that job, was it an easy process? Because I think, just now moving into that sector is becoming more and more challenging. So how did you get it right?
I think at that point in time, yes, there were a couple of us already trying to get into industry. And I think, to be honest, to me, I actually don't even recall whether I applied or I was just called and the recruiter was just trying out her luck, or what. I honestly don't remember, to be honest, but I just recall that I was called in for an interview, and I went through the interview process and I passed. And through that, then they told me that, look, this is what's going to happen. Yes, it's going to be a salary cut. You do not have any experience within the manufacturing space. So are you okay with that? We will train you, and then post that, I guess you can make of it what you will. And for me, the honest truth at that point in time, and I think because I really still had that voice from that gentleman, that colleague of ours who spent so many years in one position, I really needed a way out. But also, I think it was just to say, look, in pharmacy, we have done, for lack of a better word, so many modules. They spoke of so many things. I've done the therapy, I've done the practice. There's still a little bit of that chemistry and pharmaceutics that I felt, hey, one needs to explore in that light. And at that point in time, for me to explore that, it meant manufacturing. So I think I just took that leap of faith. But I guess also it's because I started, I mean, home is Limpopo, but then I moved to Johannesburg to start afresh for varsity. I was alone. I did not have any friends. So I think that in its own helped me to say, look, it's okay to step away from your family, from your comfort zone, to go and start something new. So it was that easy, because already I have been, I think, 6 years by then, or 5 years, I don't remember, outside of home, away from home. So it was quite easy to do that. But I think also, now in hindsight, the way the pharmacy curriculum, and well, from the school, but also from SPC's point of view, or is it the government, I'm not sure, having 1 year of internship and another year of community service, that alone made me not to have attachment issues, because I was like, okay, 1 year, I'm done. 1 year of internship, I'm gone. 1 year of community service, I'm gone. And I had just started as a grade 1 pharmacist then. And it was still easy for me to say, look, I do not have roots here. I can easily go. So I think that one of all of those things like together somehow contributed really to it being okay for me to travel to yet another far province. Already I'd gone to two different provinces. So that was just a third province that I'm going to. So it wasn't really, it was like, okay, business
Wow.
as usual.
Interesting perspective. Yeah, so then you said you moved into the ministry, am I right?
Yes.
So
Oh,
how did
but
you get that right?
yeah, actually, yes. Moving into the ministry, I think when I was still in Aspen in production, um, I think for me, well, as much as I got into production, I loved it with every bit of me. Like even now, I think I can always go back to production because I really enjoyed the rush and sometimes the working in shifts, working overnight. That was really great. But deep down, I had this inclination that for me, it's all about the people. So as much as, yes, I'm making the medicines, but I felt I needed the human touch. And actually for me, coming into pharmacy was more the nudging aspect of it was the health aspect of it. So while I was actually studying, while we were actually in production together, there were a whole lot of pharmacists, all of us we knew, everyone else started studying, let's progress ourselves in terms of what we want to do next outside of production. They were doing quality assurance, some into regulatory. I, funny enough, went to study public health. So that that was a bit of a weird a weird direction. I mean, you're already in production, you can be the next biggest thing in production, but I was like, my first love is public health. So let me go and study public health. Actually, I was accepted to study a postgrad in quality assurance, but I was like, you know what, let me follow my first love. And it was actually through my actually studying the public health that I got an opportunity to actually go into the Ministry of Health. Actually, no, let me revert back a bit. As I was studying, after studying my public health, I had to leave the production aspect and I joined Pillow Pepper. I'm sure you know the Pillow Pepper training.
Oh, of course. Wonderful.
But yeah, I think that's where my first love started because I had an opportunity when I was doing final year to go and serve in the Pillow Pepper training.
Yes.
So that's where I think I really fell in love with primary health care, rural health. And then when I left Aspen before, and then that's when I actually went to Pillow Pepper while I was still studying to really just continue working and serving the community. And I also felt that sort of like works in line with my being in studying public health. Sorry. And then after that, though, I went back to production again. I moved back to Johannesburg, and then I was a production manager. So I think my life was just going through the motion. I became a production manager, and then I left that job and I went into full time, well, to do another master's. Well, I have sort of like two masters. And then I went back to say, I always wanted to study full time. Let me just go back. And I went for my second master's, which was more in epidemiology. So it was through that the opportunity to work in the Ministry of Health under the Affordable Medicines Department came into be. And in hindsight, I see that as preparation, all those things that I've done, because the work was more in supply chain. But then it being in supply chain, it was contract management where you're managing suppliers, where you're looking into quantification of medicines, how are you ensuring that medicines become available in the country, the demand and the supply chain of things, all of that. So I looked at it as what I have done in production actually helped me to be at a better advantage in terms of managing a supplier, because I know the ins and the out of production, what it means when it comes to end of the month, what it eventually translates into the customer. So I looked at it from that point in time. And funny enough, when I was in the Ministry of Health, I was managing now Aspen, the same manufacturing company that I worked for. So I knew the ins and out. I guess it was strategically put that let me manage the organization. And at that point in time, they were one of the biggest organizations in terms of especially the ARVs that they were distributing through our tendering process. So that's how I actually got into supply chain, or let me say my career in supply chain. But also in that, it was not only supply chain, because it's one of the biggest things that I think even today I'm really still quite chuffed about, that I got an opportunity to do. I think as I go, like I keep discovering new things that I'm like, oh, this is a wow moment in my life, whether it was just by chance or it's something that I geared myself for. I don't really know. But I had this opportunity. I think that was in 2016, if maybe you may recall. That's when the test and treat regimen started. Instead of treating patients by virtue of their CD4 count, they just said from now on, test and treat, test and treat. So I got an opportunity to actually spearhead this project of actually making sure that ARVs are available in all correctional services in the country. Because I recall back then when I was working in Joburg, Jen, like the correctional services inmates used to come to the clinic, and then they will wait there the whole day to receive all their ARVs. We used to serve them like that. And I think the policy has changed. Then the policy was, okay, we need to make medicines available for them in the clinics, in their correctional services clinics. So I spearheaded that project together with a colleague. There was another pharmacist. I think she was the head of the pharmaceutical personnel in the correctional services. So through that, we literally went around the country capacitating all the correctional services in terms of looking at how the clinics are run. Do they have medicines? Do they have the capacity to actually what can I say, to actually look after ARV patients instead of them being taken to the facilities. So that was one of the biggest achievements for me. And I was really happy. I was like, okay, this is something new that's happening. And I was tasked to actually do that, looking at it not only from a clinical point of view, but also in terms of the quality assurance of the medicines, because those medicines, we had received them through one of the international organizations. So where they were stored, the warehouses had to be internationally recognized in terms of the good distributing, so the good distribution and storage standards. So I had to look into that in terms of auditing the facility where those the ARVs were stored. It was the TEE where the ARVs were stored, but also going into I think it was almost every correctional service, but all the main correctional service around the country. We went there, capacity building, training the nurses on how to even record keeping, the things about patient adherence and all of that. So it was not only about supply chain from a point of getting the medicines there, but how to capacitate the clinics, how to make sure that patients are, that full ARV cascade, to make sure the patient gets their medicines, how to treat them, how to report if there are any issues, how to escalate if the care is beyond you at that point in time, to escalate it to probably a doctor or the hospital. So I really loved that project, and I'm really hoping that it's still going very well. I haven't checked up on it, but
That's
it was good
wonderful,
to
Lorraine. I mean, that's such a great opportunity to have been exposed to that at such a young age as well. I mean, it's a huge task, it's a huge undertaking. So well done to you. It
Thank
sounds as
you.
if, all of these steps are really laid the pathway to where you are at the moment. It's amazing how things just fell into place for you. And as much as it is amazing, but I think you also played an instrumental part in choosing the right postgraduate degree to direct you into this path. So well done. Congratulations to you.
Thank you.
So then once you had all of this experience at the Department of Health, and now that you've been exposed, what made you change? Why didn't you stay there?
I think I just have too many dreams in life, for lack of a better word. But also, maybe let me revert back. I was 16 years old when I decided that I'm going to work for the UN.
Oh, wow.
Yeah. What it looked like, how it looked like, the honest truth, I didn't know. But
You're giving me goosebumps. You are literally giving me goosebumps. That is
you know,
fantastic.
yeah, that is true. So I sometimes I reflect on this to say, you know what, sometimes our dreams are valid. I mean, at 16 years old, I was not even, I was still in high school. Who knows what I was going, who knows if I was going to even pass matric, you know? But there I was thinking that that's where I wanted to end, to serve. Well, I was always going to be in a health fraternity one way or another. But then, and for me, it would be good to serve at a global stage. But then what I see is, for some reason, this dream that I had, somehow, I don't know whether I can say things fell into place, to be honest. Sometimes I feel it's by chance, but sometimes maybe it was just that gut feeling to say, yes, I chose this career. And I knew within this career that there's always something more. I think I always hungered for, I'm like, there's always something more, that this can't just be it, you know? And also in terms of me starting work with the UN, it was just also by a conversation with a friend while we were studying our masters. Actually, before I even joined the Ministry of Health. We're just talking, and I was like, yeah, you know, one day, what do you do? What do you want to do when you finish your masters? No, I want to do my PhD here. I want to do this. I was like, one day I would like to join the UN in passing. And it was 2, 3 years later that the friend just shared an advertisement with me. It's like, oh yeah, this. I remember you said you wanted to work for the UN. Yeah, I saw this. Try it out. And me
Wow.
being me, not being afraid to get the answer no, I was like, you know what, I have nothing to lose. I mean, and but funny enough, when I looked at it, that CV, I mean, the terms of reference, it was like that job was just tailored for me. Like literally, they wanted someone who has done public health, someone who has experience in manufacturing and supply chain. And I was like, but where else? I mean, these things don't even match. Like, where
Yeah.
else do you find someone who has worked in manufacturing but
Mm.
has something in public health? Like, those are two different
Yeah.
schools of thought in terms of, you know,
Yeah.
career progression. But hey, someone in Copenhagen decided that that's the kind of person they wanted, and I was at the right place at the right time, and really I applied, and yeah, the rest is history. And then I joined the UN. So
So, I mean, I just want to say, I think, a lesson for me here is that never stop dreaming and never stop putting it out there. I think somebody will be listening. That's such an important take-home point for all the listeners that I think we underestimate that sometimes.
true.
We think, it sounds so silly in our heads, but in reality, it's possible. We just have to
That's
put it out there. So
that's
thank you for
true.
reminding me about that, Lorraine. That's fantastic.
And sorry,
Yeah,
just to
so
add to that,
yeah,
yeah, sorry, I think just to add to what you were just saying, I think I also wanted to add to say, let's also be prepared. Like, I think
yes.
for when you are speaking of that, I feel, yes, it seems far-fetched as much as I say this job was meant for me in terms of how the terms of reference were structured. But more than anything, it found me prepared. I feel, yes, I did all of this working in manufacturing. I did that for me to fulfill a certain aspect for myself, but I was prepared. Like, I showed up for
Mm,
that work, for so whatever, even if you know the right path of where you are going, prepare for it. Even
yes.
though, as I say, for me, yes, I didn't know, but when that time came, I was like, I have been working for this with my career, whether it's something that I studied or it's something that I worked in. I made sure that I was prepared for it. I did not say, oh,
Mm,
in order to get into the UN, you need this. I'm going that way. So I'm going to forget about a certain aspect of it. So I always really
mm.
showed up and I prepared every step of the way. So I think
Yeah,
that's also very
it
critical.
reminds me, sorry, it reminds me of the something I read. I can't remember who said it, but they said it's never luck, it's actually preparation meeting opportunity. And
Mhm.
that's you. That really is you. You almost as if you prepared for exactly where you were heading.
Mhm.
So well done. So now that
Thank
you're at the UN, right? And
you.
what an amazing opportunity. Now you've moved all the way across continents to a very cold place.
Yeah.
um, now that you have this amazing opportunity and you reached this position in supply chain, what did you do? What was your typical day like in that
Okay.
role?
Mhm. Maybe let me revert back a bit in terms of what I had done before I actually am now here in supply chain. I worked as a pharmaceutical specialist in one of the organizations within the UN, where it was more what I was doing in the Ministry of Health under the Affordable Medicines Department, but more at a global scale. So that's really how this all started. It was, but then when I was still only focusing on South Africa and the 9 provinces, now it expanded to globally, literally.
Mm.
And it was now more focused on, it was still ARVs, it was malaria, it was TB, and a bit of non-communicable diseases. So whatever that I had done, I was doing within South Africa. Now I had to expand it to globally. Now you have to consider not only regulations within South Africa, but global regulations, global
Mm.
markets, and etc. So it had to I had to expand my scope of thinking. I really, yes, I understood South Africa and more the SADC region well and how it worked, because most of our processes were quite similar. But then now moving into other regions where, for example, language issues, like example, when you're looking at a medicine, now it must have French, now it must have Spanish, or some countries it must have Russian, it must have Arabic, all of those dynamics now one had to consider. And also that different countries now, they use different medicines. We may have analgesics, but maybe a certain country, well, this is just example. I think everyone uses paracetamol, but certain countries have different regimens, where, especially for the ARVs, where different countries have their own regimens. So one had to familiarize themselves with that. So again, one had to delve deeper to study, to learn. Like there's
Mm.
always an opportunity to learn where you don't know anything. Go back, teach yourself, and learn. So even with that space where I started, I had to just go back and realize that, okay, I'm very much well versed with the South African system and how things work. Now I'm in a different space. Now I need to teach myself. I need to consult with colleagues who have been here for a long time. And I need to, yes, I know what I was bringing to the table in terms of my knowledge, where the other colleagues did not have. But at the same time, they brought a different knowledge that I was not well versed with. So especially in terms of market research, like I've not done so much market research in my life than I did when I first joined in the one organization. And then I moved to a different organization after that. I think it was just after 10 months. Then I went more into quality assurance of medicines. And that's
So
really
still within
where,
the UN, am I right?
yes,
Still
still
within the
within the
UN.
UN. Exactly. So, well, I went in Copenhagen. Luckily, the different organizations are all seated under one building. So I just literally moved from the one wing of the building to the other wing of the building, but the different organization altogether. And I think my manufacturing life sort of like kept calling me. So I was like, okay, let's join quality assurance and really expand my knowledge of quality assurance at a global scale. So that's what I have been doing before I actually joined supply chain, where I am currently in this new role. But then even with that, quality assurance, that's another a mammoth task, also trying to appreciate what is happening in the global scale, trying to appreciate the different regulatory processes and requirements that are in the global scale. And well, for UN agencies, we mostly align with what WHO does, as sort of like the WHO pre-qualification program becomes sort of like our mother body, for us being sort of like the sister agencies, because we are more on the procurement side, not
Mm.
necessarily on the pre-qualification side in terms
Yes.
of our health products. So aligning ourselves with what WHO does, but also the global market, and also appreciating that we have so many countries that have different levels in terms of their regulatory processes and what their needs are. And so
Mhm.
one had to really take into context all of those requirements when we are saying this is the quality requirements or the quality standards that we need for a certain product. Is it going to be fit for purpose for the next country if it's not registered? So we look into all of those things. So those are some of the work that I had done in quality assurance, trying to build technical specifications for the medicines. Well, right now I'm in the sexual and reproductive health space. That's literally currently where I'm based. I'm with the UNFPA now. So our focus has now shifted to mainly just sexual reproductive health medicines, like your contraceptives, your maternal health medicines, etc. So now we're trying to see how we can best support countries globally in the sexual reproductive health space. But then similarly, other agencies, those who are working with ARVs, those who are working with anti-malarials, that's what we are doing from a UN front in terms of the type of quality that of medicines that we are trying to, to avail to different clientele globally. So yeah, that's what I've been
So
doing.
yeah, interesting, because I mean, quality and procurement go hand in hand, right? They work
Definitely.
together. You can't say they're separate. They hand in glove, basically. So I mean, I can imagine. I mean, going and understanding all of those mammoth tasks of undertaking regulatory differences between each country must have taken a lot of time, which is interesting. So you have to think on your feet, and you must be aware of all the different regulations. I mean, SAPRA
Definitely.
alone has just so many requirements. I can just imagine working
True.
globally. It must be very interesting. So,
Yeah.
so what, in your current role, I mean, from what I read, and interestingly enough, it was National Humanitarian Day on the 19th, I think it was.
Exactly.
Um, Interesting, yeah. So I mean, it's so lovely for you to see a pharmacist. I mean, I'm sure it's so rewarding that you're giving back on a global scale. How amazing is that? How lucky are you? So what in the past few years has been the biggest challenge that you've faced from the procurement space? And I'm sure COVID must have been a fascinating time as well.
Yeah, no, definitely. I think um, maybe let me use COVID and then use it as a segue into supply chain for me. But then
Yeah.
because I started with COVID while I was still in quality assurance. So what COVID has taught us, I think those who are in the supply chain space, is that we were not ready.
Mm.
Like we are not ready from a supply chain point of view in that this phenomenon happened globally and everything was shut. Before COVID, there was very little talk about decentralizing our what can I say, decentralizing our procurement processes, our supply chain, or where our commodities were housed. Well, for me, coming from an African point of view, I always, even when I joined the global stage, I was like, but why don't we have something regionally to serve the region or to serve the country, etc. But how the most of the UN agencies were structured was such that they are very centralized, especially for us and other UN agencies. You find that even as a procurement agency, from a procurement point of view, you procure and then your health products are housed probably in Europe. Some are in, I think, the Middle East. And I think to serve the Latin American population, but also more the African population, we do not necessarily have those warehouses where we can say, this is where our stock is pre-positioned to immediately serve the global community. So that really hits almost everyone unexpected, but also even from a start, most of our raw materials, they come from China, they come from India. And those were one of the first countries to just shut. And when they are shut, manufacturers cannot get their raw
Mm.
materials. Those who have finished pharmaceutical products that are manufactured either in India or China, they cannot be transported. So I think
Mm.
that was the lesson learned for the whole global procurement organizations. Well, not only in health, but for the purposes of today, definitely for health products, to say, hey,
Yeah.
we need to expand. We need to expand if really our aim is to serve low middle income countries, those that are definitely situated in different geographical locations. Something needs to happen so that we can serve them when they are in need, when everything shuts. So now communication has changed to say we are trying to decentralize or regionalize. So the whole, not only within the UN agencies, but all the global procurement agencies, health procurement agencies now, they are looking into how to decentralize. What does it mean when you're saying you're decentralizing? Not from a quality point of view, definitely, because there's a whole lot of falsified medicines that are also doing the rounds in the name of international organizations. So now how do you safeguard that the quality of medicines, but also now making them available closer to where they are needed the most? So that is where the whole trajectory is going, but also even from a supply chain point of view, that is what we need to look into, to say, how are we capacitating the different regions within the global space to say strategically, where are you positioned? Yes, you are global, but where are you going to position
Yes.
your stock so that it's easily accessible to the recipients, the different countries that you are serving, because most of the countries that we are serving are not in Europe, but then
Yes.
the warehouses are stored in Europe. So how do you decentralize that? And how do you also capacitate the different countries so that they also then can come and say, when we need to procure medicines or health products for ourselves, they are closer to us. We can easily access them. And also the issues of lead times, there's a whole lot of issues,
Yes.
especially in procurement. Lead time is always an issue. So how do you even curb that? So by now, the global supply chain looking into decentralizing, there's all the other issues that we are also trying to curb. But then now the main issue is, how do you still maintain that quality? That's really where we are looking into, even within the different spaces of the health products, either with pharmacists or other colleagues within the space. It's how do you still maintain that quality, but how do you also ensure that you're meeting the need and you're not, we are not leaving those
Compromising.
Exactly.
So when there's always opportunity, we come back to South Africa, so you can come and ask them to open up a massive warehouse. We have the space, and we have the infrastructure, and we have fantastic SAPRA regulations. So you say it ticks all the boxes. So come to South Africa. Help
If
boost
I
our
had that voice
economy.
to say, hey, if I was to advocate, definitely I'll advocate for my country. Well,
Please.
I know this, I know what we are capable of, and I know what we can do. So
Please.
definitely I would advocate for
Yeah,
that, but no.
that would be awesome.
But it's for
Um,
the global, like especially for the regulatory space. There's what we call Zazibona. And there's a whole
yes.
lot of friends that I know who are in there. So they are looking at it from that point of view, that the Zazibona is SADC, but then we have the MAA. Well, now I'm just speaking from an Africa point of view anyway. We have the MAM, and then also they have the Africa CDC. So all of those, that's where they're all working together to
Yes.
say, are we making it from a continental? Is it regional? So it's from a quality point of view, there's also that. So there's a whole lot of talk, and that's happening even to date. I think next week there's also these talks that are happening to try and say, involving all this global organization, to say, how are you capacitating, well, in this case Africa. Other regions also, they have their own issues. Currently now I'm based in the East European and Central Asia region. We're also trying to look into how do we now capacitate, the supply chain here, because it looks different. Remember, also the
Yes.
epidemiology of the countries are
Yes,
different.
exactly.
So
Yeah.
how do you become contextualized to the region itself, because they are all different. So that's really what regionalization also comes into helping to say, no one size fits all.
Is the same. Yeah, exactly. It has to be on a needs basis.
Exactly.
So I mean, I'm sure you've seen on LinkedIn, there's quite a few questions that came up by the listeners, and I'm going to try and go through a few. So, in terms of one of the questions, I think it was Deborah that asked, if you had to give advice to a young pharmacist who wants to pursue a similar path as you, in terms of working for an international company, humanitarian organization, what advice would you give?
Okay. for now, because I'm here, I think because I know better, I think I would have been more intentional, not necessarily. I was, as you can say, I don't want to call it luck that I was lucky to be here, but luckily, whatever, all the things that I have done brought me here in terms of my career and what I studied. But at this point in time, now that I know that there are opportunities to actually pursue this, I would say, for one, definitely, yes, you have your BPharm degree, great, tick. But then there are other postgraduate degrees that you can do, either specializing in supply chain or specializing in humanitarian logistics or even in public health, because all those are available, they are there. Back then, I honestly did not know that they were available, but also, especially from a humanitarian point of view, it was not very clear what it is. It's only now that it's actually becoming apparent that we know what is happening in that space. But I would say, don't be afraid to study, but also apply for jobs, because very seldom will anyone just say, hey, I have a job for you, come. Apply for jobs, even in South Africa. Well, luckily, on also at the same time, not so lucky for us, is we do not necessarily have so much humanitarian activities happening in South Africa, but we do have these small NGOs that are available in the country. So for me, I would say probably start. I think we do have MSF, but also we have UN agencies in the country. And to be honest,
Yes.
I did not know that then, when I was still seeking to work for the UN. But I realized that we do even have a regional office in South Africa, which is based, the regional office for Eastern Southern African region is based in South Africa. But we do have country offices where you can work in South Africa. So it's worth noting at those international agencies. There's also CHI, I think USAID is there, I think MSF is there. All these organizations are there. But I think maybe as South Africans, we are not that, we from a pharmaceutical point of view, we know all these traditional professions that we've been into. And yes, there's now the regulatory space. But only now in hindsight, I realized that, oh, we actually do have this in South Africa, just that they are not very prominent, whereas in other countries, whereas from my colleagues that I know of, who are in different countries, where maybe low and middle income countries, where you do see the international organizations that are very prominent, that they get exposed to these organizations from earlier on in their lives. Whereas for us in South Africa, it wasn't that prominent. So I would say,
Yeah, so I
by all
think,
means,
yeah,
get
just do your
into
homework, eh? Just do your homework as much as possible if you're really
exactly
keen on joining that
and
space.
apply. The worst that you can get
Apply.
is no.
Yes.
For me, I always say, if it's
Yes.
no, you are still where you are, but it can be a yes, and you move.
Yeah, exactly.
Mhm.
And I always believe rejection is never a rejection, it's actually redirection. So you never know.
That's so true.
I had an interesting question from Mahmoud, who said, who wanted to know, in terms of emerging trends and innovations within the supply chain space, have you
Mhm.
seen anything that will shape the way supply chain is moving, in which direction it's moving? And yeah, how do you think innovation is going to change that, basically?
That's a very good question. And well, I'm not sure if I can say it's innovation, but maybe yes, maybe no. But then data, like the world of data now helps channel and helps prepare supply chain in the best way possible, because
Mm,
with data from data you can work on your supply chain from a demand side to say, this is our need, and this is how we can best serve our need. You can look into
mm,
your supply side to say, based on this data, this is what we can do, this is how we can support. So from just that alone, I will say data in itself can tell a whole lot of what's happening in terms of supply chain, that we rely a whole lot on data. And the lack of data will then mean that we are not servicing our clients well, because a whole lot
mm,
of out of stocks that from whether the smallest clinic or the highest manufacturing company or hospital, where they fail, if they do not have that data to say this informs our need and our demand. That is one of the things that can really help. And in terms of the world of artificial intelligence, I'm not really well versed in that, but I know definitely from just, I know now we have this robot pharmacists who can dispense. So I'm sure even in this space of the global supply chain, but yes, from a supply chain point of view, yes, we do actually have this, like there's what you call this, they call it a world-class warehouse in UNICEF that is housed in Denmark. So that is automation, that is automated. So also that in terms of the new innovation to say, okay, we're no more relying on the human hand, but we are now relying on machines from a supply chain point of view, inventory management point of view.
Yes.
So there's also that aspect where it has played a whole lot in terms of supply chain. So now we are trying to move into the new trajectory is end-to-end supply chain, which is very old, to be honest, just that, now I think maybe because of the new innovation and the world of data, now so many, it was definitely predominant in the private sector, but then now you're seeing the public sector is coming in with it. Even this, the global agencies are now coming into play with this end-to-end supply chain to see from the start to the beginning, let there be that visibility that also helps to curb the different challenges that are taking place along the supply
definitely.
chain.
I think, you speaking about data science is just so crucial. It impacts every aspect of pharmacy, not just supply chain. If you look at patient healthcare, chronic diseases, I mean, it's just, it's immense. And that's something we really need to explore as pharmacists going forward in terms of our career paths and postgraduate degrees, etc. One more question from one of the listener viewers is from Boitemelo, and she says, in terms of maturity assessment in the regulatory space of the countries that you work with, how has the United Nations population component that you work for manage the legislative barriers to medicines in terms of supply chain? And how has it impacted access to healthcare?
Okay. I think let me probably put that, maybe wear two hats on it, but then definitely from the United Nations, UN agencies point of view, because we sort of like have a working group of all the UN agencies in terms of the quality assurance of our health products, which, as I said, it's the WHO becoming that mother body to which we are all embedded on. So the standards is sort of like the same in terms of how we look at it, or at least we are trying to standardize it to be the same. And then we have the regulator on the other hand, with the different countries being at the different maturity levels. So as a start from this maturity level phenomenal concept was not there before. It just recently came. Before you had your US FDA, your EMA, your Health Canada, your MRH, all those being deemed as your stringent regulatory authorities. And then having all the others, being, there wasn't really a name for these other regulatory bodies. But then now that has since been scraped and is currently being phased out by WHO. And then now we are working with this maturity level where number 4, you've arrived where you are the greatest, so now all the countries that needs to serve, let me say, the global public would need to sort of like liaise or align themselves to be either assessed by WHO or just to mutually be recognized to be placed at a certain level of the maturity level. So currently there is still communication even within the quality assurance space, but also definitely with WHO more on the procurement space to say, yes, we know that maturity level 1, they are still very weak. There are so many parameters that they still need to fit. Maturity level 2, they're still falling short. Maturity level 3, but also in terms of the maturity level, it's product category dependent. It doesn't cut
Correct.
across board. You can be maturity
Yes.
level 4 for vaccines, but then for pharmaceuticals, you're still at 2 or at 1. So it
Correct.
goes
Yes.
it goes with your product category, for lack of a better word. So currently, when you're at maturity level 4, when you're at maturity level 3, you are still lacking. So you still need to be capacitated. It depends on where, because they use this tool where they assess you to say, maybe here you're okay, here you're okay. Probably pharmacovigilance, you're still not so good. Probably in terms of how many audits you do, you are still falling short. So that's how we look at this maturity levels, looking at it to say, okay, from WHO's point of view, this is where you are falling in. But also from our end, there's what we call a risk assessment to say certain health products, but this is now from an organization point of view, that the organization decides that, okay, let me say, for example, let me give an example of oxytocin. Because of the indication of oxytocin, for example, postpartum health hemorrhage, you do not want a mother to lose her life after giving birth due to the lack of quality of the oxytocin. So it's for that. What then we are looking at we're looking at what traditional we call stringent regulatory authority, or WHO pre-qualified. So any manufacturer that may fit that standard, then we are looking at them to say, okay, you are then qualified to give us those medicines.
Yes.
But for a paracetamol or for any other products, then we are looking at it more from, you can say, with the country regulatory authority. If the country's regulatory authority is benchmarked at probably, let me say, maturity level 2, they can then do that because of the risk of the product itself. So now that's how we are actually trying to look at it to say, okay, the regulatory authority has this maturity level. So because of that, then they can actually, for UNFPA, and I'm just speaking from an organizational point of view, that if we're going to say we are making medicines available under the UNFPA name, this is the risk that we are going to take as an organization, that we are looking at this standard, that it must be from, as I'm saying, I'm trying to move away from the stringent regulatory, but it must be from a higher maturity level to say, if your regulator is able to assess dossiers at that level, and you've been accredited to be a stringent regulator or maturity at a higher maturity level 4, then we can say, okay, you can then you can now, let me just say, for example, Denmark, that's where they are right now. They are, from a regulatory point of view, they're stringent. If they then assess a dossier and they are happy with it, then we can rely on their assessment. Whereas, I'll use South Africa because we have not reached there and it's my country. So whereas South Africa, we can say, no, because you're not yet at that level, then we will not say, we'll say, no, sorry, whatever you have assessed will not accept it at this point in time. So that's how we are, well, from the global stage anyhow, that's how we are trying to look at it.
Thank you.
But it's still
That's
a work in
interesting. I mean,
progress.
maturity level, exactly, it is. And I think South Africa is working really hard. SAPRA is working hard to get them
I know they are.
up the maturity level. Yeah.
Definitely. I know very much. I have friends who are in there and who are really.
Thank you for that explanation. That's interesting. I mean, it's a risk-based exercise, and that's it's purely, as you say, in terms of patient outcomes, that's the best exercise to undertake in order to ensure product quality of optimum value. So in terms of, I mean, we're coming to the end, and I want to ask you in terms of skills that you think you require to work in an organization like you have, because you must come across different cultures, different languages, different hierarchies within the organization. So, I mean, what skills do you think you leaned on the most in terms of your career journey so far within this space?
I think for me, I'm trying not to make it personal, but at the same time, I think it is it is very personal. I think just being, this is not necessarily a skill, but rather it's something that I found that it worked for me, and probably even very cliched, but then being able to stand your ground. Like I learned that as an intern dealing with a patient, but then at the same time, I learned that having to make a quality call at a manufacturing company where you know that, okay, you need these medicines to go out, but at the same time, you are not okay with that, with the quality of these medicines. Like being resilient with whatever decision that you make. Like make sure that you've made that decision and you stand by it, but also being, and it's something that now I'm only learning now, being politically savvy.
Of
Because
course.
where we, yes, where we are, it's, we need to be, how can I say, we are civil servants, and we need to be
Yes.
aware that we are civil servants. We represent, yes, I'm wearing my cap as a UN personnel, but at the same time, there's a lot that is expected from me. So as much as those core skills to say, yes, I must be technical, I must be this, but then there are other skills that we need outside of just being there to understand what you say sometimes becomes gospel. So now watch what you are saying and how you are saying and how you present yourself. So it's not only, yes, the technical work that we learn, but I think I'm also fortunate in that this is what pharmacy taught us, I think.
Yes.
For us as a health worker, like you are a health worker, there's, be aware that there may sometimes be that you have that white collar syndrome where you can somehow be superior to your patient, that be aware of that and not necessarily use that to your advantage. So I think that's something that I've taken with, as I said, I think those are not necessarily skills, but those are things that I've taken with, especially in my position as a pharmacist, meeting different people from different career paths, that we find ourselves in the same space, but then I needing to bring my cap that I am a pharmacist. Like, how do you navigate around that? Where is your comparative advantage? You say, hey, I'm a pharmacist. We may be in the supply chain space, but I am a pharmacist. This is what I represent. You may be with a doctor, you may be with a logistician. As a pharmacist, what do you bring? So those are some of the things that I pick up outside of literally the technical expertise, outside of being the different courses that I've learned. I'm continue to study, like I do not stop. I continue to add to my basket of learning to expand my scope. But all of those things that they really help, and also just being aware of your position and what it stands for. For me, that's really what comes out, because as I say, whatever I say now, some may take it as gospel. And if someone's going to take it as gospel, did I represent myself well for the UN? Because that's really what you stand for. If you're wearing that, it's an invisible cap that I constantly need to be aware that I am wearing this cap. And yes, I'm serving as a pharmacist, but I'm serving also wearing this cap that I need to be aware of.
You sound like Spider-Man. What is Spider-Man's go-to term? With great power comes great responsibility.
Exactly. Yeah, definitely.
Yeah, so it sounds like that. So before we two more questions before we go. What has been the highlight of your career? I mean, we know you wanted to get to the UN and you will reach that, but other than that, what has been something that you will tell your great grandchildren about? The
Oh,
highlight in your career.
let's see. Okay, the highlight in my career. Um, I think as you say, I think I really thought I was gonna get here after I reached 40, and I'm not yet 40, and I'm here, and I'm like, okay, then what? But then the funny thing is, the highlight of my career, though, is I've reached it way before I thought I was here. The funny thing, the reason why I'm saying this is it's a personal story of mine, and it's me getting to work for Pillow Pepper.
Wow.
Because as I say, it's a personal story of mine. When I was 7 years old, I got my first pair of glasses from the Pillar Pepper train.
Oh, wow, that is
Yeah.
beautiful.
And I appreciated what rural health can do. Like
Mm,
that, hence, I think maybe wanting to work for the UN came from that. Because I was like, okay, I was just a 7-year-old. I got my first pair of glasses from a train that decided to visit rural areas all over the country. And that made me realize that it's possible. Like anything, it's possible. So I always wanted to work for Pillow Pepper, though my span was very, very short. But I think that became the highlight to say, then when I got to the UN, I was like, okay, great. So now there's still other great things. Maybe I want to throw it out there. No, I don't want to be the Secretary General of the UN, but if it happens.
I was just gonna say, I mean, before my next question, I'm so in awe of you, Lorraine, because I love the way you love giving back to the community. I think that is so rewarding, not just as a pharmacist, but as a human being. And you feel so fulfilled when you do that. And I can see
Exactly.
the joy in your eye, and your body language is just, yeah, it's amazing. So again, congratulations on achieving that. So yeah, where to next? That's my last question. Where to next for Loraine Molepo? Where are we?
For
Are we going to
me,
see you working at the World Health Organization, or
yeah, I think I'd
what
also
great
like to
things? Are you
work.
going to be the next Tedros? Who knows?
Who knows? But no, really, for now, as I said, I've just recently started well within my region now. I still want to spend some time here and contribute, but also learn, because this is a different. I have not necessarily been exposed to the Eastern Europe and Asia and Central Asia world. I'm very much well versed with South Africa, East African, what it has to offer in terms of our health system and what we
Hmm.
can do. So this is a new place. This is a new, well, let me say, epidemiological profile per se. But also now there's the humanitarian aspect where I'm now also getting exposed to having encounters in this region that I'm really getting myself into that. So I'd really want to grow in that space, however many years we spent here. But I think I'd love to work for WHO. And eventually, as I say, I mean, I still have many years within myself, either probably as a consultant or as a staff member. Definitely I would like to do something with WHO, mainly because they are, that's what I call them, the Department of Health of the world. So
Yeah. Yeah.
that's what I call them. So since I still call myself part of the health fraternity. So it'll be great to go there. In what capacity? I still haven't
Mm.
explored it, but definitely that's way too from now. I'm studying still. I don't know why I don't stop studying. I am studying because I want to get into regulatory and policy. So probably maybe with WHO, that's where I'll probably get into that, because they are more the technical mother body in terms of the health space from a global space. So even you see, even now I'm like, okay, this is what I'm doing, but where to with my career after I've done all the groundwork, I've done everything, from the not the dirty work, but the actually getting my hands dirty, being there on the ground. Where to at the end? What does it look like? It will be good to
Mm.
contribute to policy. It will be good to contribute to the regulatory space in pharmaceuticals and policy. So hopefully that's
That's
where
the
I will
next step.
end. Yeah. Mhm.
That's fantastic. It's been so wonderful chatting to you, Lorraine. You are
Mm.
honestly, from the bottom of my heart, a true inspiration. I really
Thank you.
admire the steps you've taken in your career and the strength you've demonstrated and the grit you have. And I'm
Thank
sure you're going
you.
to inspire everybody that listens to you. And I pray maybe you'll come back to South Africa and be the next health minister. Maybe that's
Hmm.
possible too.
The health minister's advisor. I think I'd love that, not the health
Okay,
minister.
yes, that would be great. That would
You
be
need to choose a
awesome.
political
Yeah.
organization to be the minister. So for now, I will be the
I love that.
advisor.
I look forward to seeing you there. Yeah. So thank thank you for taking your time and being on Pull and Perseverance and inspiring other pharmacists. And we'll keep in touch
No,
and take
definitely,
care of
definitely.
yourself. Take
Loraine Molepo's story is a powerful example of how diverse experiences and a deep commitment to one's field can align perfectly with a larger global mission. Her journey from pharmacy to working with the United Nations Population Fund highlights how foundational skills and genuine desire to make a difference can open doors to impactful roles. Her ability to navigate different areas within pharmacy and give back to her community demonstrates a blend of professional versatility and personal dedication. Working at the UN, where she ensures a consistent supply of resources to those in need, not only fulfills her career goals, but also aligns with her deeper values. Her work is a testament to how passion, preparation, and perseverance can lead to rewarding outcomes that benefit both individuals and the global community. It's inspiring to see how her career has evolved in such a meaningful way, reflecting both her personal growth and her commitment to improving lives worldwide. I hope you enjoyed this interview and stay motivated. Please subscribe and like if you enjoyed the podcast. Thank you.